Yeah. Yes. So we are going to start the session. Squamous cell carcinoma. Okay. Squamous cell carcinoma. Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions and this is the fourth speaking session for nurses and one already finished for doctors. And here we have Mr. Mahesh Kalal from Jamnagar, Gujarat, India. He's a nurse by profession. Yes, Mahesh Kalal. So this is the card for the viewers who are on the YouTube and other places, just to go through for 30 seconds. Yes. So you can start, Mr. Mahesh.
Yes, sir. Good evening, sir. I am Mahesh and one of the registered nurses in this clinic. I am the attending nurse for your queries today. Before starting the ball rolling on your troubles, could you please tell me your name and age for the documentation purpose?
My name is Abraham Lincoln and I am 51 years old and I have come here regarding my some diagnosis. The doctor told me to come and meet you. He says that there is something called some carcinoma, squamous cell carcinoma. Yeah.
Thank you, Mr. Lincoln, for telling me your name and age. Now, I have your notes here with me, and having been through these notes, I came to know that your GP has suggested you to have the suture removed. So, could you please tell me a bit more about the situation in your own words for my better understanding?
Yeah, I think that this is another name for skin cancer. I'm a little worried, doctor. Sorry, nurse. I'm a little worried. I don't know anything about this. I was just, I had a lesion removed from my hand, and the doctor said that it was squamous cell carcinoma, and I have come here to remove the stitches. I don't know what to do now.
Yeah, Mr. Lincoln, I understand your expressed concern. Uh, for your understanding, I'm going to explain you about this squamous cell carcinoma. This is one of the types of skin cancer. This is mainly caused by remaining exposed to sunlight for longer duration and due to violet radiation, which is present in the rays of sun. So, Mr. Lincoln, have you understood what is squamous cell carcinoma?
Yeah, nurse. I understand now. Actually, the thing is, I have a better understanding about what is a squamous cell carcinoma now, and I want to know if I'm likely to need more surgery to remove my other lesions in the future.
Yeah, Mr. Lincoln, I come to know that you are little worried about your health, but Mr. Lincoln, in order to boost your confidence towards your life, I am going to tell you about the success ratio of this surgery. Many people who has been through this type of surgery has had unremarkable mm, unremarkable progress, and in your case also it will bring overwhelming results having had this surgery. In your case, lesion on the skin has also been removed, and now it is next to impossible uh, for spreading of cancer further. However, having had this surgery, it is essential to observe skin regularly for new growing spots and changing and knowing changing of spots. Regular and also regular visits of doctor is also required for the further checkup. Uh, are you with me, Mr. Lincoln?
Yeah, I have a better understanding of what squamous cell carcinoma is now, and I want to ask you if I am likely to need more surgery to remove other lesions in the future.
Mr. Lincoln, I'm sorry to say that I am not authorized person to tell you about the further surgery and requirement of further surgery. This can only be told by your GP. Your doctors will. You can talk to your doctors for this regarding the further requirement of surgery. Are you with me, Mr. Lincoln?
Yeah, okay. What am I supposed to do now? How can I take care of my health and how to avoid further complications? Can you please give me some idea?
Yeah, I will be glad to tell you this about the precaution, what precaution you can take. I am really concerned about your health and your speedy recovery. Therefore, whenever you expose to sunlight, it is crucial to cover yourself from further damage to your skin. So, in order to uh, expose you from sunlight, prevent you from exposing sunlight, it is crucial to wear full length clothes and cover your body parts. So can I tell you what type of habits do you have when you come in contact with sunlight?
Yeah, actually, right. I always wear a high factor sunscreen, 30 or higher, and I wear a hat when I'm out in the sun. No doubt regarding that, because I'm very careful. But I think it's too late because the damage has already been done. I spent too much time in my childhood days, in my teenage years, in the sun. That has probably caused the problem, and I don't know what to do now.
Mr. Lincoln, I'm sorry to hear that you have been in contact with so much sunlight in your childhood, and that may be the possible reason, possible outcome of this disease. But your surgery, as I told earlier, that your surgery has been done successfully, and your overall assessment has been satisfactory by your doctors, and that is why uh, your GP has suggested you to remove sutures now, and generally, having had surgery, we remove sutures after 1 to 2 weeks. And now it is high time for you to remove the stitches. Is that okay?
Yes, nurse, let me tell you one thing. I'll make sure to look after the skin from now on. But regarding the wound, yeah, it's fine. It's improving. The condition is, getting better on a daily basis. But there's no pain. There's no discharge too. and I still think it's too early to have the stitches out. Can't I keep them for some more time? What do you say,
Uh,
nurse?
yeah, Mr. Lincoln, I understand that you want to keep your operated part very safe, and but for your understanding, according to assessment of your GP, he has fully understood your recovery, and now there is no any discharge and pain at the site of surgery. So it is essential to remove the stitches at this stage. And in every surgery, after 1 to 2 weeks, it is usually removed. The sutures usually removed from surgical site. So now in your case, I am going to explain you and make you aware about the aftercare of regarding the sutures removal. So are you with me, Mr. Lincoln?
Yeah, okay. After listening to your suggestions, the information, I understand. Yeah, you know
Yeah,
better, so it's wise to give my consent. Yeah, I'm here with you. Do you want an
yeah.
oral consent or a written consent?
Pardon, Mr. Lincoln, please.
Do you want an oral consent or a written consent?
Yes, Mr. Lincoln, before taking your consent, I'm going to explain you about the aftercares, how you have to be careful after removing the sutures from your side, surgical side. So having had stitches removed, wound side should be clean and dry. Then I tell you about the means please do not forget about the wound that should be covered all the time after removing the sutures. So now I request you to give me a written consent if you are okay with me and having given this detailed explanation regarding suture removal.
Yeah, that's very nice, nurse. Thank you very much. I am ready to have the stitches removed, and thank you for your patience and kindness. Thank you once again.
Yeah, Mr. Lincoln, you are so cooperative. I thank you for the same.
Right. So that's the end of the session. Mahesh, this is the first part. And in this first part, we'll have the role play. I'm not going to give you any suggestions right away because our artificial intelligence Simon sort of pilot is already there. It's typing your words and everything. And it will give me in the dialogue form, and I'll give that PDF to you. And afterwards, the second round, we are going to deal with the corrections and feedback and evaluation and improvements as and when required. So that will be scheduled shortly, and that's all for now. And yeah, so viewers who are watching this video, so kindly use the number 9877867360 to contact me. And yeah, I repeat, +91 9877867360. You can contact me for personal sessions. I'm with you, and we'll have quality sessions together. If at all you are interested, you can subscribe to the sessions. You can call me, and you can get connected, and you get